This is Boomer Life on CIL 650.
We're back with Boomer Life on CIL 650, today focusing on the urology program at False Creek Healthcare Center at 555 West 8th Avenue in Vancouver. Our guest in studio, urologist Dr. William Taylor. And Dr. Taylor, just before we took the break, we were starting to talk about Movember. This is the time of year when guys who can and really shouldn't ever try grow mustaches anyway, our way of sort of sticking up for men's health issues. And it started out as being all about prostate cancer. But as was the case with women's health issues and all of those runs that started a dozen years ago about breast cancer, it's expanded to other women's health issues as well, as is Movember and men's health issues. It's now about more than just prostate cancer, isn't it?
That's correct. There are a lot of men's issues that need to be addressed these days. Not only testicular cancer, which is not that common, but other issues in terms of the aging male. It's what happens to men as they get older, their libido changes. Men just don't function as well as women do at the same age. They don't see their physician as often.
Right.
Their cancers are delayed in diagnosis. Life expectancy is down. And just the kids at school, the boys at school, are not doing as well as the girls anymore. They don't concentrate as well. They don't get into university as often as they used to. So these issues are coming up now as a men's health issue. And this awareness is now a global awareness. Both men and women are fighting it. In Movember, we grow mustaches just to show support for this cause.
And we should mention that Movember is an Australian idea. You're absolutely right, Dr. Taylor. It is a global phenomenon. It began in Australia. It was embraced hugely here in Canada, and it's making its way around the world as whatever it takes to get people talking, isn't it?
That's right.
That's the bottom line, isn't it? So you mentioned when we were talking earlier about prostate cancer, this I did not know, is something that most men are actually going to get, but it's only going to adversely affect a very tiny percentage of us.
That's right. Only a few percent of men will die from cancer of the prostate. But those that do die of cancer of the prostate die a premature death, and a painful one.
Right.
And if detected early, can be prevented.
Right. And is it the same case with testicular cancer?
Testicular cancer, the sooner the better it's diagnosed.
Right. I wanted to ask something, and I don't know whether this is in the same column, but when women get to a certain age, and this is Boomer Life, so we know what we're talking about here. When women get to a certain age in their lives, some begin to take hormone supplements, estrogen hormone replacement therapy. Do guys take testosterone replacement therapy? Do we take, or should we be taking the sorts of hormones that women do so much more commonly than men do?
The answer is there are a lot of clinics, the low testosterone clinics, that have evolved, particularly in the United States, and it has been touted as the drug that will help men get by. And what sort of men? These are men who complain of a low libido, fatigue, poor sleeping patterns, and often they're given testosterone to stimulate them, to get things going again.
Right.
The only time, however, that the testosterone will work is if they have a low testosterone. Most of these men are overworked, they don't sleep enough, they're probably overweight, they may have diabetes, and they have other problems, perhaps with alcohol, which all contribute to their general fatigue syndrome. And testosterone, if given to men with cardiac problems, may cause more cardiac disease, more heart attacks and things. So
you got to be careful.
This needs to be very carefully given, and patients need to be advised that they not Hercules at the age of 60.
Sure.
A lot of men at age 60 will be naturally sexually dysfunctional. Up to 50% of men won't be functioning as well as they should be, and this may even be a natural phenomenon.
Okay, so now do you see, for example, if you're a 55, 60-year-old man and you're sort of you're exhibiting some of the symptoms that you've just talked about. You're a hardworking guy. You work too hard. You're stressed like crazy. You don't sleep well. You drink too much. All of those things. And yet you know that you're not doing yourself any favor repeating this behavior day after day after day. So would this be a great candidate to sit down with a specialist at the Falls Creek Healthcare Center and go, look, I'm just so off my game. I know I'm not doing myself any favors with my lifestyle, but I feel there's something missing. Could that something be as simple as testosterone?
Only if it's low. If it's not low, the family physician will pick up on these symptoms right away.
Is that a blood test? Is that how you determine it?
It is a blood test.
Okay.
That's not a very accurate test all the time, but repeated tests will give you a fairly good idea of what the level is for each person. And the family physician is a good person to start with lifestyle changes, alcohol withdrawal changes, things like this. And then we could sit down with these patients and determine whether or not we can help them with either testosterone or various other medications to help the sexual function.
Right. And there are numerous remedies available, correct?
There are.
In addition to lose some weight, sleep a little better, and stop drinking so much, which is a good start, right? But you need to go well beyond that, right?
We need to go beyond that.
I wanted to talk a little bit about the other types of cancers that affect men. I was talking about how over the years, with the breast cancer awareness campaigns that women were conducting 12 to 15 years ago, with all of those wonderful runs and all the rest of it, they have elevated our awareness of women's issues to a considerable level. And we know about cervical cancer and other women's issues. Is the hope behind Movember and the prostate cancer awareness, Dr. Taylor, that eventually we will be much more comfortable discussing men's health issues and dangerous ones like cancers as comfortably and openly as we already do with women's?
Absolutely. That's what is needed. Men do not talk about their problems. This is why many of their cancers are delayed in diagnosis. Early diagnosis means a chance for early cure.
Right. Now, you're a urologist, you're a surgeon. If one is diagnosed with prostate cancer, Dr. Taylor, is surgery usually the remedy, or what other possibilities can you deal with?
So as we discussed before, if you have an aggressive type of cancer that needs to be treated, your options are either surgery or radiation.
Okay.
If you don't have a long life expectancy, then various hormones can be given to alleviate the symptoms. But if you have a long life expectancy ahead of you, then you need something definitive done. Surgery is a good form. We have open surgery for removal of the whole prostate, called a radical prostate, which may be done with an incision, or it can be done with the robot. And there are various reasons to consider each of these options. Radiation is done in various forms, either by placing tiny little seeds in the prostate called brachytherapy, or sometimes what we call external beam radiation to the prostate.
Okay. So it's not a chemotherapy treatment disease or problem then?
No.
Okay.
We may use hormonal therapy to help with control of a disease that is spreading, but as a primary cure, we don't have chemotherapy for it.
Okay. So how does one go about, because you're right, you said earlier, as soon as someone says you have cancer, everything else after they've said that suddenly becomes instant white noise. You've just heard the only word you never want to hear. And a lot of people just can't get past that. How do you, as the doctor who sometimes has to sit across the desk from, as you are now with me, how do you get past that when you have to tell someone, A, you have cancer, and B, here's what you should do about it?
Right. If there's a small area of cancer in the prostate, this is where you sit down with the patient, you tell him the natural history of the cancer, how long it's going to take to grow compared to, say, a liver cancer or one other active form of cancer in the body.
Okay.
And the results of a cancer from the prostate, which are low grade, low stage, patients may live with that for many, many years and die a normal life, die at a normal lifespan.
Right.
If there's a more aggressive disease, and this is where you need to say to the patients, listen, we can control this now. We won't be able to in a few years' time. and that perhaps you should consider some active treatment for it.
Right, and of course with men, and you've already made this point, and you don't have to hammer it too hard because every guy listening goes, yeah, he's right, he's absolutely right. Guys just don't, we're not very proactive about this. We just, as you said, we're reluctant to even talk about it amongst ourselves, let alone conduct any kind of regular routine of checkups and that sort of thing. We'd rather procrastinate, frankly, wouldn't we?
We do.
And grow a bad mustache in the process.
We do procrastinate.
Well, not everybody looks good in Movember, friends. It's a great idea, but, not all of us are cut out to be mustached fellows, are we? But, you have to appreciate the effort, don't you? The fact that guys are having fun and also in the process talking about things that don't get discussed very often.
No, that's right. And this has been a huge worldwide movement, and it's raised multiple dollars for research, and it has advanced the cause for prostate cancer.
Talk to us about cancer research, if you would, for a moment, because you surgeons rely constantly on the research groups to provide you with new methods, new information, to make your jobs even more effective so you can be more efficient at eradicating and removing cancers and so on. Do you think, Dr. Taylor, candidly, in your lifetime, there will be a cure for cancer?
I think it is likely. There are multiple new drugs that are coming on the scene all the time. The new diagnostic tests. It takes a long time to translate the findings of research into practicality.
Right.
Prostate cancer grows slowly. One needs many years to determine whether one form of treatment is better than another. These are happening in multiple centers worldwide, mostly because of this extra funding we have. So it's essential.
So all the jokes you're making about that weird guy who never should grow a mustache, go ahead, knock yourself out. Just make sure you give him the money that he has, that you've committed to, because as Dr. Taylor points out, funny mustaches do raise a lot of money, and that money is doing good work, not only here in Canada, Dr. Taylor, but right around the world.
That's right.
Good stuff. Need to take a quick break. This is Boomer Life and our guest, Dr. William Taylor from False Creek Healthcare Center downtown, and we're back with lots more right after this quick timeout.
Canada's only weekly radio show dedicated to the baby boomer lifestyle. This is Boomer Life on CIL 650.